Good morning. Today we will see about a caries preventing dental material, fluoridated dentrifices. Dental caries is one of the most common chronic infectious, communicable, and multifactorial oral disease in the population worldwide. It is not a self-limiting type of disease, and without a proper care, it would lead to destruction of the tooth by acidic byproducts formed from the bacterial fermentation of dietary carbohydrates. So, the prevention of caries is necessary as it affects the person's self-esteem and quality of life. For prevention, the first step is caries risk assessment. So, this caries risk assessment helps to determine whether the patient is having low, moderate, or high caries activity so that we will be able to segregate the patient accordingly and provide with the necessary treatment protocols. In addition to the necessary treatments, the patient should also undergo a preventive oral care. So the products used in preventive dentistry can be broadly classified as a fluoridated product or a non-fluoridated product. Moving on to the fluorides, the delivery methods in dentistry, it can be topical or systemic. The topical can be further classified as a professional or self-applied, and the systemic includes the water, salt, milk fluoridation, and the fluoride tablets or drops. And today's topic, as we discussed earlier, is the fluoridated dentrifices, which comes under the self-applied topical fluorides. The most commonly available fluoridated toothpaste is sodium monofluorophosphate. It can be of a high potential, that is, with a fluoride content of greater than 1000 ppm or low potential. Monofluorophosphate dentrifices are advantageous than sodium fluoride and stannous fluoride because it has a neutral pH and it has a greater stability to oxidation and hydrolysis, which further improves its shelf life. There is an increased availability of fluoride, and there is no staining of the teeth. Various studies have concluded that this monofluorophosphate is deposited in the crystalline lattice, and in subsequent, this intracrystalline transposition leads to the fluoride release and replaces the hydroxyl group to form a fluoroapatite. And it also have antichoriogenic activity due to the exchange of phosphate group in the apatite crystals, and this reaction is not competitive of fluoride. While using fluoridated toothpaste, there should be certain precautions when you are using it for children less than 6 years, as they have a tendency to swallow it. So, American Academy of Pediatric Dentists suggests that use a smear of toothpaste in children less than 2 years and go for a pea-size amount of toothpaste for children below 2 to 5 years. Moving on to amine fluoride dentrifices. They are the most powerful enrichment in fluoride and even at low concentration. Their karyostatic action is due to the fluoride on one side and the anti-enzyme effect of the organic fraction on the other side. They also help in arresting the formation of dental fluoride.